specialized in prenatal and postpartum chiropractic care, and I want to go over belly mapping with you. We'll utilize the baby doll, and then I will show you on my 31-week pregnant belly myself. This is something that I really encourage my patients to begin between 28 and 30 weeks so that you can be aware of the position that your baby's in. It's also gives you reassurance and allows the time to connect with your baby. I also have belly massage. That's kind of something you can follow this up with on either end. So you can look that up on my YouTube page, Gaia Health, as well, to do just some connection with baby at whatever time in the day that you have. Now, the key landmarks that we're going to be looking for when we do belly mapping are the head, which is round, spherical, and it'll move back and forth, but it's not likely to pull the rest of the body with it since there's so much movement in the neck. Whereas if you're feeling the butt, so much of the body can shift around. Commonly, if you poke the butt, they're going to do a really big movement. You might feel kicks. So we're looking for that spherical region. If it's head down above the pubic bone, it's way easier to find than if it's hiding out in the sides or under a rib cage. We're also going to be looking for the booty, which the head and the booty can get confused quite a bit because they both kind of have this hard structure, roundish feel to them. The pushing out that the booty does, it feels a little bit different, and then commonly can be associated with bigger kick movements that are near it. Also, if you move the booty, it's more of the body that moves, whereas again, the head has more movement, that if you move that, it's usually just the head. Looking for where you're feeling tiny little tickle small movements, that's usually going to be the hands. And then looking for bigger punches or pushes, which will be those kicks, likely those feet. Now, when you're at your OBGYN or your midwife, you will often get fetal heart tone, and that helps you also know where the baby roughly could be. So if it's up really high, that could be the chest is up here. If it's down a little lower, it could be the chest is a little lower. So that gives you a rough idea. It's also good if they're able to palpate or take an ultrasound that you take note of where baby's at, feel around, so it gives you an idea of what you're looking for. Now, it can be tough if you have an anterior placenta or just position of the placenta, a little bit easier if the placenta's in the back, a little less of a pillowy cushion in the front. Amniotic fluid levels will change how you can feel it. The tension and tightness of the abdominal tone, the density, whatever layers we have on top can change that. And just overall body type can change how you feel things. So just do your best, and I'm going to demo how to do it on my body. So now I'm going to demo belly mapping on my own belly that's 31 weeks pregnant. And as I mentioned prior, between 28 and 30 weeks is a great time to start belly mapping just to get an idea of baby's position. It's really nice to know where your baby's at. So if baby may not be in the best position, then we can start doing chiropractic work. We can start doing rehab exercises and different movements to help open up the space and get baby into the best position as possible. So starting off, I'm going to give you an idea of the things that we're going to be looking for. So we're looking for that spherical head. Again, the head will bob back and forth more than a booty will. So if you push on the booty, the whole body will typically go with it, and commonly it'll be accompanied by kicks. We're also looking for small little tickly movements of the hands, bigger pushes and kicks of the feet, and then if you've had an appointment with your OB or midwife, you're looking for fetal heart tone and where that's located. So we'll start with my belly. On the lower right quadrant, I had my heart tones be found there for the fetus, I think almost every single visit. So the most recent one 2 weeks ago, that's also where it was. I like to start off by feeling the pubic bone and then feeling right above it. So you're going to be feeling with the pads of your hand, not pointing down. And as opposed to pressing down when you're right above the pubic bone, I encourage doing a back and forth rock to see if you can find a head, or, you know, if you're concerned about a breech baby, if you feel like you can feel a butt. So for me, I feel a really hard spherical head is what it is. And when I move it, it goes back and forth, and it doesn't have any kicks associated with it and really no other movement when I do that. So it's kind of like the baby's like, woo. Now, where I feel a lot is if I press over here, there's a lot of empty space. When I press over here, I feel a lot more of the baby's body, and oftentimes I'll feel the baby's butt really push out over here. When I press on the baby's booty, I get all these legs and kicks and pushes coming out this side, which gives me that indication that when I'm pressing on that hard region, the reason why it feels like not a head is because I can feel a lot of kicks that are associated with it, and they're stronger than what I feel, which is the little softer hand movements that are more like tickles down into my lower hip here. So I almost feel like it's in my hip and sometimes down into my cervix, pelvic floor region, which lets me know I can really feel the difference between these like small tickly movements and these big pushes or big kicks. So commonly I feel that really hard solid spot here and a hard solid spot here. And the difference between the two again is that the head just goes back and forth, back and forth. When I press on this hard spot, the body moves and I feel kicks start happening. And again, fetal heart tone here. Let's see what else. So right now I'm showing you baby head down, curled to the side like this, and then hands like to be up near the mouth and the face because the baby likes to suck on hands a lot. So I feel the hands down over here, kicks and pushes more over here, booty popping out here, and then this head has remained pretty solid. So I think the baby does this a lot. Ideally, the baby at the end of pregnancy will be in this position here, where the back of the head is towards your belly. They're facing either your spine or they're looking to your right hip. That's going to be the most optimal position for baby to come to the pelvis, smallest part of the head to exit. It is still possible to have a baby on the right side, but commonly they have to then come from here and rotate all the way around and can get stuck in this occiput posterior spot. So let's talk about positioning for occiput posterior. So head down, most optimal, obviously significantly better than if baby is head up in a breech or is transverse in a sideways position. However, an occiput posterior can often mean a more challenging birth and oftentimes a little bit more painful because a bigger part of the head is coming out. Now, the head towards the spine, back of the head towards the spine, can cause pressures that is uncomfortable for birth. But when we're pregnant, what we can feel is head down, and we may feel more pushes directly out and more hands that feel like they're crawling out as opposed to inward towards our body, maybe inward towards our hip and pelvic floor. So that's something to look out for, is where you're feeling those kicks and hands. And if you have any concerns with feeling like the butt might be the head, or that the hands and feet might feel like they're coming more midline as opposed to the side or towards the back, then that's a time to check in with your provider and ask for more palpation exams and maybe even an ultrasound if you're concerned, because the earlier we catch something, the sooner that we can do things to reduce any restrictions to allow baby to get in their optimal position for birth.